And start to. Okay. So today, Doc,
Hello?
yeah, hey. So we're gonna talk about osteoporosis,
Uh,
bone health.
Bone health in general, let's not get disease specific. Let's talk bone health, especially in menopause or andropause if you're a guy.
Okay,
After you get older and everyone tells you your bones are weak.
all right.
So, do you want to give a description? Do you want me to?
Um, I'll shoot, I'll say and then you fill
Go,
in the
go, go.
gaps. So,
Absolutely.
bone health, obviously is very important as we age, right? That's probably one of the primary contributors to, death, mortality is poor bone health. Somebody has a fracture, they fall at an older age, then they have a fracture, and now they have to have surgery, and that surgery then leads to complications and death.
You know,
So,
the number I heard on that, Wiley, is an orthopedic surgeon told me in my residency at the Mayo Clinic, they said, if a man or woman breaks a hip, for example, after the age of 70, their age is their mortality. And so what that means, if you're 80 years old, break a hip, you have an 80% chance of dying from complications of that fracture.
that's scary.
It's huge. It's
And
huge.
and then you take into consideration where you live, like here in Idaho,
With ice
ice,
everywhere,
yeah,
yeah.
like you don't want to go outside, you don't want to go for a walk. I mean, that will definitely restrict your quality of life and things like
And
that. So,
compound your bone unhealthiness
yeah,
because you're not moving.
right. Yeah, so it kind of, so yeah, that's good to be aware of that. I don't think a lot of people realize um the importance of bone health and for longevity and in our lifestyle, we tend to not, the majority of people, obviously our program members are in a, they're optimizing their bone health. And so, but for the majority of people who they don't do resistance training, they don't eat a healthy diet. Tell us kind of a little bit about how do we optimize our bone health for longevity?
Sure. Um, Osteoporosis is what people think of, or osteopenia, which means you're not quite there. But there's a lot more reasons to keep your bones healthy. Did you know the number one reason for more overall mortality across the board is frailty? So muscle weakness, muscle imbalance, and bone health. It's frailty. That's the number one killer out there. Even I would argue as much, if not more, than heart disease, because that's related. It's all connected.
Mhm.
So it's so important to keep your bones healthy. Bone health starts when you're young. When that's why we encourage exercise, resistance training in particular, because that's probably the number one thing you can do to keep your bones healthy is resistance training.
Because the muscles put force onto the bones and the bones respond by building and
By building,
strengthening.
yeah, there's two sides, and I'm telling them, not you, you already know this. There's two types of primary cells in the bone. One's called an osteoblast, which builds up the bone, and one's called an osteoclast, which breaks the bones down. And those are very, very fine-tuned mechanisms to keep good, strong bones in there. The bones, the if you look at a slice of bone under the matrix or under a microscope, we've all seen it. It looks like a matrix. It's honeycomb, it's organized, it's solid. That's the balance between the osteoblast and the osteoclast. The type of food you eat, toxins in the environment, that resistance train, and weight on your bones all keep those two in balance. And that's starts at a young age, not just when you're menopausal or older. You don't start thinking of your bone health then. You think about it when you're 30.
Hopefully,
Hopefully,
yeah.
yeah. Now, that being said, it's not too late. The studies have shown that two resistant training sessions a week can increase bone health by 24%.
Hmm.
Strength. In 24%, two resistance trainings a week. If you go to three, it's roughly 32%. And here's people are going to love this, especially people that don't like to exercise. There's no real added benefit going more than that for bone health.
What duration? 2 days, 2 times a week of resistance for 30 minutes, an
You know,
hour?
the study was very good. It talked about not time, but exercises.
Okay,
And it focused on exercise to muscle failure. So I think body weight exercises are perfectly fine. Push-ups against the wall until you just can't do them.
okay.
And then squats against the wall until you just can't do them. do find a personal trainer, get online, contact us. We can send you a list of exercises, take you 15, 20 minutes twice a week, and you increase your bone strength by 24%.
Perfect. Yeah, so you mentioned the trainer, Jared Barton, our nutritionist
Yep.
and health coach.
He's
He's
perfect.
a personal trainer. He can definitely create that workout for you to optimize your bone health and
Mhm.
lean muscle mass, right? To
Yep.
increase your overall resiliency and lifespan, really, right?
Oh, yeah.
So it's never too late to start. You definitely earlier the better, right, for all of us. And again, this kind of goes back to what we talked about with our program members, the importance of exercise as part of your program, right?
Yeah.
It's not just a recommendation, it's a requirement really to be healthy,
It
right?
really is. If you look at all the blue zones, which there's 5 primary blue zones across the country, the world, excuse me. And they're the areas where people live into the 100+ centurions actively. They're not in bed, they're not sick, they're not ill. They're 108 years old and they're gardening 8 hours a day and going for 2 mile walks. The secret to the blue zones is movement.
Okay,
It's movement. They all stay active.
okay, awesome, good to know. Um, good. So explain a little bit about the factors with menopause, andropause, hormones, and bone health. Like
Sure.
what's the
Oh,
interaction there?
that's a great question, because hormones, in particular estrogen, increase osteoblastic activity. It builds bones. Even more so than the androgens like testosterone, DHEA are very helpful for bones, growth hormone, good for bones. There's brain hormones that affect bones like FSH, high levels of FSH, which is follicle stimulating hormone, which goes up when the ovaries stop producing estrogen, actually increase osteoclastic activity. They break down bones.
Okay.
So that's why FSH is a marker of bone health as well, not only just the fact that you need estrogen.
Mhm.
Hormones are, if I had to list out what would be my primary treatments for optimization of bone health when they're already in trouble, and we should probably talk about testing in a different episode, maybe our call-ins here will have some questions. Um, it would be resistance training and movement, hormone treatment or optimization, diet optimization, stress control for your bones. Those count for your bone health. Because cortisol, the breakdown and what we call catabolic hormone, the stress hormone, increases osteoclastic activity. It actually breaks your bones down.
Okay.
So these are all, I would do that in that order for treatment.
Okay.
You'll notice I did not say any of the prescription drugs.
Yeah.
That's a totally different subject, but how much time do we got here? We got 15 minutes. Maybe we can see if there's any questions unless you have something else.
Yeah.
Because that's part of the reason we want to do this often as we can, once a week, hopefully maybe in 2, 3 times a week with our members, is get interaction, get questions, talking. I think that's just so
Yeah. We learn
powerful.
from each other for
Yes,
sure.
we
Yeah.
do. So Letty or I can't remember the other one name, Lindsay.
Lindsay and
Do
Lady.
you guys have any questions?
Yeah, I do. I have a question. You said something about how you can check your bone health. What is the process for that?
1 second there. We had our little Zoom thing had a feedback. Could you say that again?
Okay, can you hear me now?
Yeah. Go ahead.
Okay, how do we go about checking the health of our bones?
The lab testing. How do we
Oh.
test for
Oh,
all the
there we
health?
go. That was a test question. Great question there. The gold standard is something called a DEXA scan. It's an X-ray scan. They scan your whole body and they look at 3 particular areas of high rates of fracture: your wrists, your lower back, and your hips. And that DEXA scan is based on how quickly the X-rays go through the bone. So just like sound travels through water better than sound travels through air, that's the kind of the concept. These X-rays go through, gives us a densiometry is what it's called. So how dense are these bones? And they score that using something called a T-score and a Z-score. A T-score, and this is where I have a big issue with this particular diagnosis of osteoporosis, is comparing you at whatever age you are to a 30-year-old. In other words, the DEXA scan T-scores, in my opinion, are creating pathology. They're making aging pathologic. Whereas the Z-score is age-like comparisons, much more accurate.
Okay.
What is a large population of people, well, let's say you're 70 years old, and a T-score is going to show you up against a 30-year-old. Guess what? Your bones are going to be thicker.
Right. Yeah.
Z-score is going to put you against other 70-year-olds, and 10-1, you're probably pretty comparable.
Okay.
The test that I like even more than that is called an NTX DPD. It's a urine test that looks for what we call collagen cross-linked fibers, and it gives me an idea about the amount of bone breakdown, how much osteoclastic activity is going on. And that's a neat test because it's about $30. You catch your pee first thing in the morning in a cup, bring it into our office, and we check for these. And we can monitor every 3 months, 6 months to see if your resistance training, your hormones, your diet, which includes supplementation, is working, because we should see that number decrease or at the very least stay where it is.
Mhm.
That is, to me, is more accurate because it's now giving me a more real-time reading of your bone health. Whereas the DEXA scan, as you know, Wiley, Medicare only paid for it every 2 years. A lot can happen in 2 years.
So that's a way to, that urine test is a way for us to monitor how much bone you're losing in your body's breaking it down
Yep.
and you're peeing it out basically. So then we can monitor how much that's changing as you're making these changes and
Exactly.
modifications. So,
And I have great case examples of women who had a very high NTX DPD. We put them on hormones. We got them on the proper supplementation. They started resistance training, and that number went in half in 3 months. That's how quickly we can say, wow, what you're doing is working, keep it up.
mhm.
It's the coolest thing.
And so based on that, we can then know that you're building bone.
Yeah,
Or at least maintaining. it.
at
You're
least
not
maintaining
losing
at the very least.
Yeah.
At the very least, you're maintaining it versus losing it. But again, back, and that's why I explained that osteoblast, osteoclast activity as we get older, because of the catabolic hormones, the lack of estrogen stuff, the breakdown, the osteoclasts are overactive. And if we can slow that down, we know that there's a balance and you're most likely building bone.
Nice.
And that's cool. And then the real test of it is when you slipped on the ice in Idaho, did you break your hip? If the answer is no, you're doing something right.
Yeah, or the very worst, you step wrong and break a hip, like
Yeah.
like
Yeah, I just had a patient a few weeks ago who had a non-traumatic ankle fracture. She stepped on it and broke her ankle.
Yeah.
She didn't twist it, nothing. It was non-traumatic, and that's a problem.
Yeah. Okay. Good question. Does that answer your question, Lindsay?
Oh, they're typing up here. That's great.
Yes. Yes, thank you.
Perfect. Okay, so Letty said, I heard once that prescription drugs only maintain bone. Are things available that actually rebuild bone? So
Yes, do you want to answer? Sure.
you go.
It's hormones. Hormones build bone. And plus, remember, for a house to be built, you may have the best builder in the world, but if he can't get wood for your framing, he ain't gonna build a house. So hormones are your best builder. The house is your nutrients. A good diet. Get your calcium from food sources. So your greens, your dairy, your nuts and seeds, and then support it with proper amount of vitamin D, especially here in this at this latitude. We do not get vitamin D this time of year.
Mhm.
Taking your vitamin D, but not too much. Again, that's a totally different topic we can get into. And then support it with other nutrients like magnesium, boron tends to help. A good multivitamin with minerals is a great addition to that. But that's the frames for your builder, the hormones, to put bone back together.
So the hormones are kind of what kind of direct the osteoclasts and the osteoblasts and say, don't break down any more bone. And then you have to have the material, the building blocks to help maintain the bone. With supplements, a lot of people, they think osteoporosis or osteopenia, I should take calcium supplements. Is that
No, do not take them.
okay?
Calcium in pills has been shown to increase calcification of arteries,
Okay.
especially when vitamin D is too high. And we really saw that with the whole COVID thing, because it was quickly figured out that vitamin D helps fight COVID. And if you're taking a calcium supplement with that much vitamin D, you are laying that calcium in your arteries. So
Okay.
it's always best to get your calcium from food sources.
Okay. Similar to iron, right? I mean, if you're iron deficient, then you may need iron supplements, but just doing an iron supplement,
Not
it's better to get it through your diet so that your body breaks it down properly and uses it like it needs to.
Yeah.
Is that right?
Exactly right. Yeah, remember iron is a very oxidative metal, and so it causes a lot of stress in your body.
Okay.
That's why spinach. That's why Popeye didn't take iron pills. He ate spinach.
Okay, good. So, and again, that's similar, we're talking about, calcium, so calcium supplements are not optimal for bone health.
Right.
But vitamin D is, and then your hormones, and then, the top of the pyramid here is the resistance training.
Yep.
To encourage the
Yeah.
building of bone.
There's something else I should just mention to show you how powerful that is, I was told once by a patient who's involved, ex-Air Force, and so he was very familiar with the space station. And if those astronauts are in no gravity for more than 6 months, when they get home, they're bedridden. They lose bone that quick.
Wow.
Without the resistance of gravity.
Yeah.
They're literally bedridden. I can't remember how long he said, a week or 2 weeks after a bunch of testing, they actually let them stand up.
So gravity is our friend.
That's the only time it's your friend, because every other time it winds up hurting you, whether it's your skin, your belly, or you fall off a cliff. Gravity is not your friend unless it's your bones.
Yeah. Good to know. All right. Let's see. Lindsay says, will we have symptoms of poor bone health that we need to watch for prior to menopause? So are there symptoms of, other than obviously a fracture, your bones break easy? Are there any other symptoms that you have weak bones?
No, unfortunately, there's not. It's one of those, it's kind of like the analogy I would compare it there was like, is colon cancer. You don't know about colon cancer until it's too late. So that's why we encourage screening at a younger age now, 45. And I was just reading the other day that I'll probably move to 40 in the next couple of years. By 2028, I think it was, that'll be recommendation will be age 40 and above, you screen for colon cancer, because there is no warning.
Mm-hmm.
Once you have blood in your stool and have colon cancer, it's probably too late.
Okay.
Bones, very similar. You don't have proof of problems. That's why be preventative. Exercise, lift weights,
Mm-hmm.
eat your nuts and seeds, take your vitamin D or get out in the sun during the summer. Make sure your hormones are balanced. There you go.
I think it's interesting how we, in conventional medicine, we're kind of encouraged or required to do. We need to get all these patients to do these screening tests, but if you're not actively in a program or taking care of yourself, then you increase the risk of cancer and osteoporosis.
Mm-hmm.
So screening is designed to find the problem. Yeah.
Sorry, I'll repeat that. Screening is designed to sell drugs.
Okay, yeah.
Sorry.
Yeah, well, money, unfortunately, money definitely is the driving force in a lot of our medical care and our medical system. So, but by completing your program and following the plan and, learning as you go so that you can really be your own physician, right? I mean, that's the goal here.
That is our goal.
You are equipped to prevent as much as you can, but also change your health trajectory, I guess, right?
Yeah, that's a great word.
But yeah, so it is important to do screening especially if you're getting older, you're in perimenopause, premenopause, but if you want to do screening, you should also want to do prevention, right?
Right.
Like, what do I need to do to
Yeah, that is my beef, and that's why our program is so powerful. I have nothing against the screening if you get something to do with your results,
Mhm.
not just take a pill.
Right,
That does not do anything. That changes numbers, not health.
yeah,
So yes, I agree with you totally. Screening is important and we should do it, but you have to have a plan with that.
right,
And that's what we do. That's our programs.
Yep.
Is we give you a plan other than a pill.
yep.
Oh, that was good. A plan other than a pill.
Right.
Somebody write that down.
Yeah, good slogan. Okay, so then Letty says, with hormone replacement in bone health, doesn't that leave you prone to cancer?
Oh, boy, that's a big one. That is, boy, we need not another half hour. We need about 4 hours on that one.
Mhm.
The short answer is no. The long answer to it take 4 hours. I think it's very individual. I think you should talk with your provider about your risks of cancer across the board. Hormones in and of themselves do not cause cancer. Or every 18-year-old out there would have breast cancer. Every pregnant woman would have breast cancer. Estrogen's through the roof.
Right,
So it doesn't cause cancer. So it's a very individual thing. It's that bigger picture. And so to answer your question, no, it will not cause cancer. But it's important to evaluate risk versus benefits of anything, including, I mean, there's risk with vitamin C that people don't realize. And that's over the counter. People take it all the time. I mean, the number one drug related to death in the world are anti-inflammatories. Like
Over the counter,
ibuprofen,
yeah.
Motrin, Aleve, Arudis. Number one cause of death are those drugs, and we take them like candy.
yeah,
So same thing, you need to understand risk versus benefits that as it applies to you. But to say it again, to answer your question, no, you're not at greater risk of cancer, but talk to someone like me or Wiley so we can help you weed that out.
right. Have that discussion so that yeah, because it is personalized, right?
It's
And that's
very personalized.
what our programs are all about is personalization of your plan
Yeah.
based on your metabolic health and
Yeah.
your labs and life and history and all that, right?
Exactly. And even if you got cut off driving in to see us, that changes things.
Stress,
Yeah.
yeah, okay. Okay, out of everything we discussed, what is most important for bone health?
Oh, that's someone smart here. Resistance training,
Okay,
Hands
so
down.
top of the.
top of the list. If there's anything you can do for your bones over pills, drugs, hormones, supplements, resistance training,
Okay,
hands down. And just to repeat 2 times a week, muscles to failure will increase your bone strength by 24%.
all right, so you can do body weight stuff, body
Body
weight
weight stuff,
squats,
yeah.
push-ups,
Push-ups on the floor against the wall. Talk to our dietitian, Jared.
yeah,
Contact us. We have lots of little programs that would be wonderful, easy to do with a towel, a chair. I mean, you don't have to join Gold's Gym.
yeah.
You can do this and really improve your bone strength.
Yeah, good. And I mean, obviously, we have lots of resources out there with the internet, YouTube. I mean, you can look up exercises for beginners, bone health,
Yeah.
all that, you know. So,
Oh,
but yeah, definitely reach out to and talk to us if you're not sure if you're doing the right stuff or not, so that we can help guide you with that. That's what we're here for. And so, do we have any more questions from our members here?
Sorry, I'm leaning forward because my eyes are
No,
not
we're
the
all
best.
squinting.
We need to have a Zoom thing on how to improve eyes because I'm going to listen to it.
All right, any other questions?
No more questions for me.
Okay, awesome.
Awesome. Thank you.
Okay,
Thanks for joining us, and we'll see you next week.
yep. All right, take care. You guys have a good day.